I'm Stephen Tatter. I'm a professor of neurosurgery. I'm the co-director of the Gamma Knife Center, and I'm the medical director of neurosurgical oncology at Wake Forest Baptist Medical Center. There are many different kinds of brain tumors, and the two most common kinds that we think of are both malignant brain tumors. One are gliomas, and the other one are metastases. And the treatment options are quite different depending on which kind of brain tumor we're thinking of. But in general, we could say surgery, radiation, and chemotherapy are the treatment options for brain tumors. So our Gamma Knife is one of the busiest Gamma Knives in the country, and we've treated over 3,000 people with the Gamma Knife. We have the latest model now, but we started out in 1997 with what was the current model then. And we treat many people with a variety of different conditions, including both malignant and benign brain tumors. So we treat people with brain metastases, people with meningiomas, people with acoustic neuromas, and a variety of other kinds of tumors. Yeah, there are some things that aren't tumors that we treat with the Gamma Knife, including trigeminal neuralgia, which is actually one of the most frequent things that we treat, which is a condition of extremely intense pain in the face, but it's intermittent. It's like a seizure in the nerve, the sensory nerve from the face, the trigeminal nerve. And the Gamma Knife will usually stop that completely and allow people to get off their medications for it. The other thing are brain arteriovenous malformations. Among the non-malignant tumors that we treat, the most frequent one is a meningioma, and that's a growth of the lining around the brain. So it doesn't start in the brain tissue itself, but can press on the brain tissue, and if it keeps growing, can cause problems by putting pressure on the brain. And then the other kind of a non-malignant tumor is an acoustic neuroma. That's also called a vestibular schwannoma, is the technically correct name for it. And it's a tumor of the hearing nerve and the balance nerve. And if that grows, it can cause problems by pressing on the brain, hearing loss. Some people already have hearing loss, but in either situation, if it looks like it's growing, we would recommend often treating it with the Gamma Knife, and that would allow someone to avoid the need for open surgery. I think the Gamma Knife is almost always just a single treatment, and the generic name for Gamma Knife would be stereotactic radiosurgery. Even though there's not any cutting involved with the Gamma Knife, the name surgery and the name knife in Gamma Knife comes from the precision of the Gamma Knife. The mechanical precision of the Gamma Knife is about 0.2 of a millimeter, the thickness of a fairly thick sheet of paper. And so that's how accurately it can deliver the gamma ray beams. It's about the same accuracy that you could cut on a line, or actually a little higher accuracy than we could cut on a line with a scalpel. And so that's where the term knife comes from. But what it's really doing is delivering the gamma rays very precisely so that we're not giving gamma rays to normal tissue. Then we can, and that allows us to use the Gamma Knife to treat lesions in the brain in just a single treatment. Well, if we were using other techniques, we'd have to divide it up into 15, 20, 30 treatments. So in that sense, Gamma Knife is like surgery. It's just a single treatment for most people.